Stay with me, we are almost at the hospital.
All units, the hospital is on fire!
Welcome to Life in 2046. Today we're going to be discussing a healthcare system in crisis. Why do we say the healthcare system's in crisis? Well, one aspect of it has to do with spending. Our per capita spending is $14,885 a year. Next year it'll probably top $15,000 per person. When you look at our peer countries, other major developed countries throughout the world, they're spending an average of $7,500 a year, roughly half of what we anticipate we'll be spending next year. What's driving that? Higher service prices, higher drug costs, and administrative complexity account for a great deal of it. But of course, cost isn't everything. We wouldn't mind spending the extra money if we were actually getting better results because of it. But the results don't prove that out. You can look at several different ways. Life expectancy, where our life expectancy is a 3.7-year negative gap, and it's widening by the year. Maternal health and infant health is lower than the averages. Preventable and treatable mortality in the United States is quite a bit higher than in the comparative countries. Adult obesity is also higher. Heart attack and stroke survival is equal to or better, and cancer screening survival, we lead in detection. So those are good things. Basically, the U.S. excels in specialized emergency care, but we lag in public health, chronic prevention, and access equity. To be more specific about the costs in the system now, our total U.S. healthcare expenditures is $5.3 trillion a year. That's where the $15,474 a person comes from. That amounts to 18% of the gross domestic product of the United States. And it's anticipated that this is going to continue to grow. And by the time we get to 2033, it will be over 20% of the U.S. economy. So both cost and results are issues. What's going to happen over the next 20 years to make this a better situation? One of the efficiency and effectiveness issues for medical care in the United States is the lack of integration of the systems. To provide a personal example of some of the technological issues, in 2024 I was admitted to the hospital overnight for the first time since about 1967. I was surprised to see the lack of integration of technology. But then one night I was being prepared for surgery the next morning. Someone identified as a hospitalist, who I guess used to be called the attending physicians, decided to issue a drug for me. I was a little skeptical of this and texted with my own physician about it, who called back immediately and indicated that that drug could kill me, given the fact that I was having the surgery the next morning. So we put a stop to that immediately. This caused me to start investigating the technology during the remainder of my stay. And among other things, I found out that they were operating on a version of Windows that was no longer supported and, in fact, dated back to the 1990s. This hospital is part of one of the major hospital chains in the United States. So I'm sure some are doing it better, but I would imagine that an awful lot of them aren't even doing as well as these guys. So one of the benefits of the current advancing technologies is our ability to create an integrated central health system. This system will integrate all of the health information on everyone in the country. Anyone who has legal access to the system will be able to determine the current status of a person, what they're doing, what needs to be done, and for research purposes, unindividually identified information can be processed to help with research and development of new approaches. So, who will participate in the new system? First, of course, are physicians. Currently, some physicians have no medical systems whatsoever. Those that do are scattered throughout the industry and not available in a central repository. Next, of course, would be the hospital. The direct sharing of information real time between the physicians, the hospital, and the patient will be a major advantage to all participants. We'll bring in the drugstores. The pharmacies will provide the information for pharmaceuticals and vaccinations that have been given to patients that again is available to all participants in the system. This information cross-referenced between different pharmacies will allow AI to verify that proper amounts of drugs are being distributed and that the drugs have no likely contraindications with each other. Next, the inclusion of real-time laboratory results will provide that information immediately to everyone involved, particularly the physicians in the hospital and the patient and their representatives. Including imaging in the system will provide information throughout the community trying to service the patients as to what's going on, and again in real time to stop any delay in transmission. Since not all surgeries are done in hospitals anymore, the inclusion of surgery center information into the system will help to make a more complete picture of the patient's situation. And finally, and perhaps most important, the including of information from nursing as to what actually has happened to the patient and what the nurses have seen and experienced with this patient will round out the information necessary for the system to provide the optimal health care for this patient. So what results do we expect to see from the implementation of the central health system? First, the central data bank itself, providing information from a single source on all the participants in the system and the ability to, without identification, address that information for the purposes of research. Next, the same information will be available to all authorized participants. All data will be immediately updated, which will help with the accuracy of information upon which decisions are being based. AI monitoring will observe treatment as it's developing and can identify issues before they become critical. They can also be used to cut down on fraudulent and excessive use of the system. Finally, the system should provide for easy collaboration between all parties to provide the optimum care to patients. A centralized system will go a long way to facilitating the possibility of a single payer healthcare system. We're the only developed country on earth that doesn't have a single payer healthcare system. It's estimated in a Yale study that such a system would save approximately $450 billion a year in the US. Money isn't everything. Our previous information has also shown that the coordinated single-payer healthcare systems in other countries are outperforming us in terms of results. And this is not with the need to necessarily nationalize the whole thing. We wouldn't be taking over doctors. We wouldn't be taking over hospitals. We would have just a single-payer healthcare system. The health and insurance industry spends millions of dollars to buy off legislators and also to get their messages out, including fake issues. Some false issues include death committees. No major country has death committees in place. No doctors, they'll not work under this situation. They'll continue to work and profit. And hospitals going broke. Once again, there's no reason why a effective system would ever be built in such a way that it would cause hospitals to go broke. What we do have to have is a Health Economics Committee, an independent body that's charged with setting fair prices for all healthcare while preserving the quality of the system. And finally, all of these technologies are going to lead to some great medical breakthroughs over the next 20 years. Currently, people are working heavily on the genomic medicine and precision care, personalized therapies based on genome codes. as well as AI-driven diagnostics and drug discoveries. Those are moving ahead right now. In the next 5 years, we'll see a lot more movement in regenerative medicine and tissue engineering, as well as immunotherapies and cell-based therapies. From there, we anticipate we'll be moving forward into nanotechnology and drug delivery, as well as mind-body interfaces and what's called neuromodulation to allow the mind to help the body heal itself. And then beyond that, more of the mind-body interfaces and more predictive and proactive wellness. Currently, the 65-year-old demographic population spends more than double their share of the overall population. The more we can do to create a better environment and prevent as many diseases as possible, the more we can eliminate those costs. Thanks for watching Life in 2046. Please be sure to subscribe to the YouTube channel if you've not done that already. It's entirely free. And as always, with any questions or comments, email us at life@2046@gmail.com.